Hello viewers, good evening. I welcome you all on the behalf of Indian Medical College to this online class. So dear viewers, in today's session, we have our enthusiastic and energetic speaker, our beloved Dr. Anjali Shete from GMC Medical College, Aurangabad. She is an associate professor from the Department of Physiology and she is having a plenty of teaching experience behind her. She'll be taking a class today on cerebellum circuits and functions. Good evening and welcome, ma'am. It's our immense pleasure to have you here with us, ma'am.
Thank you. Thank you very much, Kavya. Thanks for
Dear
the nice
viewers,
introduction.
thank you so much, ma'am. So, dear viewers, if you have any doubts or any clarification, you can just type them in the comment section below and your queries will be clarified by her at the end of the session. So, ma'am, thank you so much for accepting and you can start the presentation now. Thank you.
Thank you. Thank you, Kavya, for giving this opportunity. I hope all of you are very much interested and as enthusiastic as your team. Okay, so as she has given my introduction, presently I'm working as an associate professor in the Department of Physiology, maybe far away from you, but now connected with an technically connected. So we'll start with today's session without wasting time. Now, as I have been told that this cerebellum is very much important in the exam point of view. So the objectives of this today's session, excuse me, yes, the objectives of this present session is exam point of view, to list the common questions asked on the topic, to explain how we can write the answers to long answer questions, to explain what points to be covered in a short answer question, and if time permits, to understand the answers which are expected by the teachers in a case-based question. So let us begin with what are the common questions which are asked in cerebellum. The long answer questions which are very commonly asked are these are the common questions. What are the different functional divisions of cerebellum? Discuss the physiological significance of neuronal circuits of cerebellum. The second question which is very commonly asked is describe in detail the functions of cerebellum, give an account of cerebellar lesions, and enumerate the clinical test to assess the cerebellar functions. So very commonly these two questions are asked. If you go for the SAQs, these are the list of SAQs which are very commonly asked. List the functions of cerebellum, add a note on cerebellar dysfunction. Very commonly asked question. And secondly, we can again have the functions that write a short note of on role of cerebellum in control of body posture equilibrium, muscle tone and stretch reflex, and control of movements. So if you just go through this particular slide, what you have is very commonly the functional divisions are asked. And if you break down the long answer question, it is very commonly asked as an SAQ. I'll give an example of a case-based question. Now, this is a very long history, but in short, whenever you are planning a case-based question, what is there is with the symptoms and the presenting complaints, a short case is planned. And this particular case, as it is based on cerebellum, related questions will be asked. So these may be the set of questions which are asked in the examination. So this is a very short history. You can go through this short history afterwards also. And if you have any queries regarding this, you can very well ask at the end of the session. So if you concentrate on this particular new, according to the new curriculum, these are the very commonly asked questions. But this again, if you go through the questions, are same questions like the cerebellar dysfunctions, the functions of cerebellum, or the importance of neuronal circuit. These will be the questions which are asked very commonly, but the format will be different. So we are going one by one to each of these questions. Coming to the first question. The first question was the functional divisions of cerebellum and what is the physiological importance of cerebellar circuits. So whenever you are writing an LAQ, you have to keep a short introduction. Now this is related to cerebellum. So what introduction you are going to write is that it is the largest part of hindbrain and it is very commonly known as silent area of the brain. Why it is silent? Because electrical excitation does not cause any conscious sensation and rarely causes any motor movement. And that is why it is known as silent area. Very commonly, it is also known as chota dimag. Coming to the anatomical divisions of cerebellum, anatomically, there are two fissures which are commonly divided this cerebellum into three parts. The first is anterior lobe, which is lying in front of the primary fissure. So this is a primary fissure and this one is anterior lobe. The second is the posterior lobe, the lobe functional division, and the third one is flocculonodular. So if we are dividing the cerebellum into three parts anatomically, it will be divided into three by two fissures, anterior lobe, posterior lobe, and flocculonodular lobe. Coming to the next division, what part it has? It consists of two cerebellar hemispheres and which are connected by median vermis. So it is very well seen that these are the cerebellar hemispheres equal and the median structure is known as vermis. So this is one division by which cerebellum can be having three parts. If you are interested, if you are very fast in writing, you can also write these phylogenetic divisions. These are dependent on the evolutionary stages: archicerebellum, paleocerebellum, and neocerebellum. As the developmental stages, you have these phylogenetical divisions. But this is not compulsory to have to write this answer in the examination, the phylogenetical division. What is more important is this part, the functional divisions of the cerebellum. So regarding your long answer question, this is how the cerebellum is divided into three parts functionally important. The first one is vestibulocerebellum, which is what is the flocculonodular lobe and the adjoining part of the vermis. What is the function of this? The main function of this is provides neuronal circuits for maintaining the body's equilibrium. As it is a vestibule, it is maintaining the equilibrium. The second part is spinocerebellum. This is most of the vermis of anterior and posterior lobe and the adjacent intermediate zone. So this is the middle part of the cerebellum and mostly it coordinates the movement of the distal portions of it. The third one is cerebrocerebellum, which is the lateral part of the cerebellar hemisphere. And this part receives all the input from different parts of the cortex like motor cortex, premotor cortex, and somatosensory cortex. So the first part of the long answer question, you can write the anatomical division, you can skip the phylogenetical division, and then you have to write functional division of the cerebellum. Now coming to the circuit part. Before explaining the circuits, in short, you have to write down what is the histological structure of cerebellum. The histological structure, the gray matter, always have the outer gray matter, the white matter, and you have particular deep cerebellar nucleus. In the cerebellum, this is how the cerebellum looks, but you don't have to write or draw this particular figure in the examination. So what you have is five main types of cells: stellate cells, basket cells, Purkinje cells, granule cells, and Golgi cells. So there are five cells, and they are arranged in three layers: the molecular layer, the Purkinje cell layer, and granular cell layer. This is the part which you have to write whenever you are writing the neuronal cell. This figure is very much important. This is a functional figure. You have to practice this particular functional figure. Now this is just the explanation of the previous slide. What it has three layers: molecular layer, Purkinje cell layer, and granular cell layer. Now coming to each of these layers. What this granular cell layer has? As the name suggests, it will be having granular cells and it will be having Golgi cells. So there are two types of cells which are present in this particular layer. Coming to the Purkinje cell layer. If you see this particular layer, it is having only the Purkinje cells. The molecular layer, they have the stellate cells, the basket cells, and along with that, you also can see the parallel fiber. So this is how the circuits, the neuronal cells are arranged in the cerebellum. You can also see the white matter, and in the white matter, you can see two types of fibers which are known as input fibers. In the coming slides, I will show you the details of this. These are mossy fibers 1, mossy fiber 2. So they are taking some information towards these cells. And the next is blinding fibers. You also can see a structure which is known as deep cerebellar nuclei. So this is what is the neuronal circuit of cerebellum. This is a functional figure. You can practice this. Now coming to the details of this circuit. Again, this is a detailed description. As a long answer question coming, taking into point how much time you take, I have jotted down some important points which you have to write. So the first one is molecular layer, which is having stellate cells, basket cells, and the nerve fibers. What are these stellate cells? These are star-shaped cells, very superficially located, and they synapse with the parallel fibers of granular cells and axons of Purkinje cells. So this is the first one. The second one is basket cell. This is also present in molecular layer, and they receive the input from parallel fibers, and their axons form a basket-like structure around the Purkinje cells. The third part, which is present in the molecular layer, is nerve fibers. What are these nerve fibers? These are the fibers which are bifurcation from the granule cells. So they will be forming the dendrites of Purkinje cells, clamping fibers, and parallel fibers. So this is how the molecular layer is there. The second part, which is Purkinje cell layer. Now this is a single layer which is having only the Purkinje cell. And the Purkinje cells are the largest neurons in the CNS. They are large flask-shaped cells, and the dendrites extend into the upward layer, that is molecular layers, and the axons, they make the inhibitory synapses with the deep cerebellar nuclei. And you have to remember that this is the sole output neurons of cerebellum. You must have gone through your lecture, so you can remember this. Coming to the third layer, that is the granule cell layer. This consists of granule cells itself and the Golgi cells and some of the ossina fibers. So what are these granule cells? These are small compared to the Golgi cells, spherical neurons. They receive input from the mossy fibers, and their axons, they ascend up into the molecular layer and divide into a T-shaped bifurcation and forms the parallel fibers, which makes the excitatory synapses with all other cells, Purkinje, stellate, basket, and Golgi. The second cell is Golgi cell. It is somewhat larger in size. The dendrites project into the molecular layers and they receive input from the parallel fibers. The cell bodies receive input from the Purkinje cells and mossy fibers. The axons make inhibitory synapses with dendrites of granule cells. Now, if you are writing all these things, you have to remember that with the help of the figure, the functional figure, it is very easy to remember. So practice that functional figure, you can very well remember all the types of cells. Coming to the inputs of the cerebellum, which are the parts of neuronal circuits. In the previous picture, you have seen that there were two input fibers. The first one is clamping fiber and the second one is mossy fibers. Now, what are these clamping fibers? These specially are originating in the inferior alveolar nucleus and they converge on a single Purkinje cell. And from the Purkinje cells, then the collaterals also are going to the deep nuclear cells. So there is a connection between one clamping fiber to one Purkinje cell. And this clamping fiber is specially coming from the inferior alveolar nucleus. Why? The importance in the coming slide when we are discussing the functions of the cerebellum, we will let you know. Now this, the second input is mossy fibers. These mossy fibers, The climbing fibers are coming only from the inferior oligoid nucleus. Apart from that, whatever inputs from higher brain, brainstem, thalamus, and spinal cord, all the inputs enter the cerebellum via these mossy fibers. They also send collaterals to the deep nuclei of the cerebellum, and they proceed to the granular cell layer, synapse with hundreds of granular cells. Now, this is the difference. If it is a climbing fiber, it is synapsing only with the Purkinje cell, and one-to-one connection is there. Whereas the granule cell is synapsing with hundreds of granule cells. So this is the difference. First, you have to remember this. Now, these granule cells send very thin exons up into the molecular layer, where they divide into two branches in each direction and form parallel nerve fibers. These parallel nerve fibers then synapse with the dendrites of the Purkinje cell, as we have seen in the figure. Synaptic connections of the mossy fibers are weak. Large numbers must be stimulated to excite the Purkinje cells. Why this is the difference? Because one mossy fiber is connected to many others. So they require the cellular strength to be much more. So these are the two types of input fibers. So again, this is a particular figure which is from Brighton. So this is again the same figure, but this is not a functional figure. So you can again revise whatever I have told you. Three layers, molecular Purkinje granule. Then you have the deep nuclei, and this is your input. One is mossy fiber, and the second is climbing fiber. Climbing fiber completely from inferior oligoid, whereas mossy fiber are from all other arteries. Where they are going? The mossy fibers are going to the granule cells, and the granule cells will be again having connections with all other cells by these parallel fibers. So this is one type of circuit. Apart from that, they also have the collaterals to the deep cerebellar nuclei. And this is your second input, that is climbing fiber. Especially it is going to the Purkinje cell. So one-to-one connection is there. Again, the collaterals are going to the deep cerebellar nuclei. So this particular structure is known as the neuronal circuit. So you have these three layers, five cells interconnected with each other, and the two input fibers, and only one output, which is coming from Purkinje cell. So from the Purkinje cells, it goes to the deep cerebellar nuclei, and from the deep cerebellar nuclei, the output from the cerebellum is coming out. Of course, it will be influenced by all other fibers. So this is the neuronal circuit. What is the importance of having these complex structures? So I hope all of you have finished your lecture, because only from the writing and LAQ I'll be dealing with. Now this complex structure of connections gives the particular properties to these particular structures, the cerebellum. The first particular property which is allotted to this cerebellum is it can have feed forward inhibition. When we are discussing the functions, what is the importance of this particular property, we are again going to discuss this. Now, what exactly is this feed forward inhibition? As we have seen that this is granule cells, okay, and how this is activated, the mossy fibers are going to connect these granule cells. They are going to activate this, okay. So these activated fibers, granule cells, are forming the parallel fibers. These parallel fibers are connected to all other cells, and one of the cell is Purkinje cells. So this, if mossy fiber is exciting the granule cells via the parallel fibers, it is also exciting the Purkinje cells. And this Purkinje cell is in turn, this is also having a basket cell, which is in here having a control over the activity of this Purkinje cell. So there is an inhibition. So since both the Purkinje cells and the basket cells are excited by the same input, So this granule cell is going to excite the basket cell also, and it is going to excite the Purkinje cell also, and which is having an inhibitory output. So this particular property is termed as feed forward inhibition. So this is a property which is given to Purkinje cells. The same property is also shown by granule cell itself. So these are the mossy fibers. The mossy fibers stimulate the granule cells. They also stimulate the Golgi cells. And when the Golgi cell is stimulating, these Golgi cells, they inhibit the granule cells. So this is what the mossy fiber stimulating granule cells. Mossy fiber also stimulating the Golgi cells. And when this Golgi cell is stimulated, it is going to inhibit the granule cells. And this particular property is known as feed forward inhibition. This granule cells also shows feedback inhibition. So what is this feedback inhibition? Is that it is granule cell is stimulated, it enters the parallel fibers, via the parallel fibers, it again stimulates the granule cells, and then there will be an inhibition. So it forms a loop, and this particular loop is known as feedback inhibition of granules. So this is the importance of this particular neuronal circuit. The third important thing, which is very commonly shown as a property by cerebellum, is damping of signals. Now, how this damping of signal occurs? So, whenever you are having a rapid motor movement, say for example, you are running, direct signals from the cerebral cortex or brainstem will increase the deep nuclear cell excitation to perform that particular activity. But what happens that these Purkinje cells, the signals will be just few milliseconds later, the signals will be there via the Purkinje cells and to the deep nucleus cells which are inhibitory. Okay, so there is all other inputs will cause the excitation of the deep nucleus cells and they will cause that rapid movement. But a few milliseconds after, this Purkinje cell is causing the inhibition of these nuclear cells. So what happens is there is a first rapid excitatory signal and which enhances the motor movement, followed by an inhibitory signal which stops the muscle movement from overshooting. Say, for example, I'm holding the mic. Okay, so if I have to hold the mic in a hurry, I will plan that particular movement, and all the inputs will be coming towards the deep nuclear cell, and that particular hand movements I will do. But I have to stop that particular activity at some point, and this inhibition is occurring via the Purkinje cells. So this particular delayed line negative feedback signal is known as damping signals. Now coming to the important property of the clambing fibers, which we have seen in the previous slide, that the clambing fibers are having one-to-one connection. Why this is a special treatment to these clambing fibers and the Purkinje cells? Why? Because whenever you are learning a new movement, a new motor act, this particular circuit will be activated. So whenever you are doing something new, incorrect motor enhancements or inhibitions by cerebellum will be done. And then they will be corrected by repeated actions till it forms a precise performance. So cerebellum learns the degree to which support the onset and offset of contraction plus the timing of contraction. I'll give an example. So this is for the first time if I'm giving the Zoom lecture. Now I have to adjust my voice, and this is a new motor activity which I am learning. So I have to adjust my voice. So what I will do, I will adjust all the motor activities and I will decide at what point I have to stop this activity, at what point I have to enhance this activity. Finally, till it reaches the perfection level. This is how a new motor activity is learned. You can take the example of driving a vehicle for the first time. So that is a good example. You can take that. So this is the particular neuronal circuit which is important for learning a new motor activity. Now you can alter this particular sensitivity this particular sensitivity through the granule cell excitation also. And then accordingly the changes will be done via the climbing fibers. So you have the interconnections. So major part of learning occurring via the climbing fibers, but there are also small inputs coming from granule cell layers that will also cause some change in your activity. So what they are causing, these climbing fibers produce complex action potential. There is a prolonged depression in the parallel fiber synaptic activity, which is termed as long-term depression. And then the synapses will adjust accordingly to adjust the change motor output. And finally, the activity will be performed. So this is the physiological importance of this particular neuronal circuit. So that was the answer for your first LAQ. So if you are again revising it, what are the different functional divisions, discuss the physiological significance of neuronal circuits. Then what you have to write is anatomical divisions of cerebellum, functional divisions. You have to write the histological structure along with the figure, then different cells and layers of cerebellum, and finally the neuronal circuits along with their properties and the physiological significance. So if you are writing this much, this LAQ is sufficient for this particular question. Coming to the next question, which is describe in detail the functions of cerebellum and give an account of cerebellar lesions. Enumerate the clinical test. So what it is a continuation of your previous sessions. Okay. So what we have seen is anatomical parts, the functional parts, and the neuronal circuits. Now, due to these neuronal circuits, what are the different functions of the cerebellum which are allotted to this? If they are not working normally, then what will be the lesions and how you are going to detect it. So we'll continue with this. If this is a question which is asked, even if it is not related to functional divisions, again you have to start giving a small introduction. So here what we can write is how the cerebellum is functionally divided. So we have gone through this particular slide again: vestibulocerebellum, spinocerebellum, and cerebrocerebellum. So this is the first introduction you have to write. Coming to the functions. Now, first, if you are very slow in writing, what you can do is you can enumerate all the functions of cerebellum and then go on explaining the answers for each. For the presentation point of view, what I have done, because due to the limited time, what I have done is I have started directly explaining the function one by one. So the first important function is control of body posture and equilibrium. This is a function which is allotted to vestibulocerebellum. So what it does, it controls the balance between the agonist muscles and antagonist muscles when they are working, whenever there are rapid changes in body position. Say for example, even during your walking movements, so there is always the activity of agonist and antagonist muscles, and there should be a balance between that, and this particular balance is maintained by vestibulocerebellum. Now, how it does? The signals from the periphery tell the brain how rapidly and in which direction the body parts are moving. So, from all the periphery, the brain will know. Vestibular cerebellum calculates in advance where the body parts will be during the next few days. So it has a vision that it knows that this is a part 1 activity, but in part 2 activity, what will be the positions of the body parts. So what it does, it provides the anticipatory corrections to postural motor signals necessary for maintaining the equilibrium, especially during the rapid movements. And this is the function specially for allotted to vestibular cerebellum. So see, this is the importance of this vestibular. Otherwise, the progressive smooth movement will not be possible. Suppose you are walking, you are running, then it will be very difficult. You will not know what to do next. But this particular thing is already taken care by the vestibular cerebellum. So it calculates in advance that this will be the position of the body parts, and accordingly it will send the signals to the muscles, agonist and antagonist, and the body posture and equilibrium will be maintained even if you are doing a rapid activity. This particular body movements is always supported to the corrective movements of the eyes. Okay, so whenever your head is rotating, every time head is rotating, along with that, there is corrective movement of the eyes. And this is via the meridian longitudinal fasciculum. So always the cerebellum is having the sensory information. So the head movement is the agonist antagonistic muscles are moving, but the eyes movement, they are also coordinated along with the functions of vestibular cerebellum. So this is the major part by which it takes the help from the sensory information and maintains the body posture and equilibrium. The second part, it controls the muscle tone and stretch. How? This is the function which is allotted to the second part, which is spinocerebellum. So this spinocerebellum will send the impulses to fastigial nucleus, then to the ipsilateral vestibular nucleus, bulbar reticular formation, and they will inhibit the gamma motor neuron discharge. If you remember your spinal cord lectures, this gamma motor neuron, if discharge is decreased, this decreases the excitability of stretch reflex. And as the excitability of the stretch reflex is there, it decreases the muscle tone. So this is how it controls the muscle tone and it has a control over the stretch reflex. So whenever there is a change, you can have accordingly your muscle tone. Normally, it is always a decrease effect is seen via the spinocerebellum. But in a normal condition, we can't feel that. So cerebellum forms an important site for alpha gamma linkage responsible for muscle tone through its control of reticular and vestibular pathways. So remember the connections of the cerebellum, and via these connections, it gives an importance and decreases mainly the stretch reflex and thus controls the muscle tone. So this is your second function of cerebellum. The third function is the control of voluntary movements. What exactly it does? It does the coordination of movement by regulating the time, rate, extent, force, and direction. So it is regulating every part of the movement. And that is how it is coordinating the movement. How these are done? By the comparator function, by damping action, and control of parasitic movement. So whenever you are doing the control of voluntary movements, these are the activities which are done. Now what is this comparator function? When a movement is performed, the intermediate zone of cerebellum, it receives the input from where? From the motor cortex and the red nucleus. So as it is a motor cortex, it will give you the plan. So what is the plan of the movement? So that information will be given by the motor cortex. Whereas from the peripheral parts, what actually is happening, that information is coming to the intermediate zone. So the intermediate zone is having both the activity. From higher side plan and from the peripheral side, the actual movement. So what it does, it compares what is happening. If both are matched, it's okay. If they are not matched, then this information will be sent to the interposed nucleus. The interposed nucleus will correct the signals. Say for example, there is disparity between these two, the plan and actual movement. It will correct again the signals, and these corrective signals will be sent to both parts, the higher centers via the thalamus and to the red nucleus via the rubrospinal tract to the spinal cord. So the spinal cord again will give to the muscles. Then the activity will be changed. So say for example, you are learning something. For the first time you are doing playing cricket. You are practicing catch. Okay. So for the first time, it is not possible to do exact activity, but this will be compared, and this is how the comparator function of the cerebellum is operate. So there will be a smooth coordinated movement of agonist and antagonist muscles, and that too with a patterned movement, purposeful patterned movement. This is possible with the help of cerebellum. Coming to the planning of sequential movements. So what it does, lateral parts of the cerebellar hemisphere, which is cerebellum, it has a two-way communication with the premotor also and sensory cortex also. So whatever plan of the movement which is there in the cerebral cortex is transmitted to the cerebellar hemisphere. The laterocerebellar zone plans the activity pattern for the next sequential movement while the present movement is still occurring. And then it progresses smoothly from one movement to next in orderly succession. So this is how the planning of sequential movement occurs. Say for example, I'll give my example. So I have to plan this particular session. The first thing I requested to take the lecture, but then it was told to me that the lecture is from the exam point of view, how to write the answers you have to do. Now what I did, I planned some PowerPoints and they are arranged in a sequential manner so that whatever thing which you are viewing, it's like a complete answer. Or you can take, if it is not clear, you can take the example of a movie. So you have different parts recorded and then you see a complete movie which is in succession. So this is how we always see our movements also occur. And this planning of the sequential movement, it occurs by the lateral part of the cerebellum. This also has the timing of movement. It controls the timing also, the lateral zone. Without this capability, the person becomes unable to determine when the next sequential movement needs to begin. And maybe sometimes the next movement will be too early or too late. And there will be failure of smooth progression of movement, which you must have experienced so many times. So timing, where to stop that activity is very much important. And this is a function which is allotted to lateral parts of cerebellar hemisphere. One common asked question, the function, which is commonly asked question of the Viva. What is servo mechanism? What exactly is servo mechanism is that the cerebellum influences the activities of all the cerebral cortex from for smooth, sequential, and voluntary activity. And this particular activity, so it is having inputs from all parts of the cerebral cortex, and accordingly, the voluntary activity will be planned. So it is taking from sensory part, it is taking from the motor part, it is taking from the premotor part, and then it is controlling the activity, it is planning the activity, it is timing the activity, it is coordinating the activity, and this particular mechanism is known as servo mechanism function of cerebellum. It also has the cerebellum. It also has extramotor predictive function. Now, what it is? It can predict the rate of progression of auditory and visual phenomena. How? Say, for example, a person can predict how rapidly he is approaching an object from the changing visual scene. So suppose in a closed wall is there, in a closed room, a wall is there, and you are walking towards that. So you very well know that this is a particular time, at that particular point, I will be reaching towards this particular and this particular wall. So change the visual scene, again you can plan it. Say for example, a puddle is there. So and you are walking on the road. So you can very well from a distance judge that this is the time that at this particular point I have to turn my vehicle, or if I'm walking, I have to turn my direction. And accordingly the plan of movement, the coordination of the movement and the smooth succession of movement will happen. And this is extramotor predictive function. So that finishes your functional part of cerebellum. Coming to the cerebellar lesions. What are these cerebellar lesions? The common causes to cause the cerebellar lesions is vascular occlusion, trauma, and tumors. And what are the general features? Suppose the cerebellar hemisphere, if it is affected, if there is lesion, then there will be ipsilateral dysfunction. And if it is a vermis lesion, then it affects both the sides. That you have to remember. If the lesions are there in the cerebellar cortex, then there is a movement abnormality which disappears gradually as compensation occurs. So after the treatment, you can have the abnormality corrected. But if there is a deep cerebellar nuclear lesion, then generalized and persistent defects are there. The clinical cerebellar disease in man is most commonly damage to the neocerebellum, which forms most of the bulk of cerebellum. So if this neocerebellum part is damaged, Then we can see various type of disorders. What are these characteristic disorders? These are the first one is autotonia and hypotonia. As we have seen, the function as control of muscle tone. So loss of dentate and interposite nuclei will cause hypotonia. As it is a deep cerebellar nuclei, it will be ipsilateral hypotonia. Due to loss of cerebellar facilitation of the motor cortex and brainstem motor nuclei, there will be this particular hypotonia and autotonia. Autotonia is loss of tone, hypotonia is decreased tone of the muscle. Ataxia, in coordination of the movement will be there. So the function is coordination of the movement. If the cerebellar lesion is there, you can't coordinate the movement, and that particular condition is known as ataxia. Then the third commonly seen is intention tremor. So whenever you are performing a voluntary act, the movements tend to oscillate when they approach the intended object. First, there is overshooting, then vibrating back and forth several times before finally settling on the object. And this is termed as intention tremors. You can remember your example of first time pricking your finger for the hematology practicals. So you have that intention tremors. Then of course the cerebellum is normal, but just for the first time you are doing, so that is why you are having that particular part. Then dysdiadochokinesia. Now diadochokinesia is a term which is given that there is orderly progression of rapid movements, but this will not be possible if your cerebellum is having any injury. So that condition is known as dysdiadochokinesia. No orderly progression of rapid movements. So you have rapid pronation and supination of hands, but there will be jumbled movements with this. It will not be possible due to loss of perception of instantaneous positions of parts during the rapid. So we have seen in the functions part that it has a prediction that this will be the position of in the next succession activity, but this will be lost, and due to that there will be dysdiadochokinesia. Then you can have nystagmus. So tremors of the eyeball when one attempts to fixate the eyes on a scene to one side of the head. So there will be rapid tremulous movements. So there will be failure of damping system and damage to the flocculonodular nodular lobe. Dysmetria. The movements are poorly carried out in direction, range, and force, and movements are overshooting their intended mark. And this is termed as pass pointing, or they may fall short, which is known as hypometria. Then you have synertia. What is that? Lack of coordination between agonist muscles and antagonist muscles. So if you are just lifting the hand, this simple movement will be there. Lack of coordination can be seen. Dysarthria, the speech, rapid and orderly succession of individual muscle movements in the larynx, the mouth, and the respiratory system. Due to the coordination, the speech is possible, but due to lack of coordination, the inability to adjust the intensity or duration of each syllable, there will be jumbled vocalization, and this is termed as dysarthria. Then you have decomposition of movements. So the movements seem to occur in stages at various joints. It is not a smooth coordinated movement. Then you can have a drunken gait. So there is difficulty in maintaining the balance and walks in a zigzag line. And the attitude, the rotation of face to opposite side, which is pulled by the helping muscles, lowering of shoulder on the affected side, leg is abducted and externally rotated, and trunk is bent with concavity on the affected side. So the whole attitude of your body posture is like this. Spontaneous deviation. If the arms are held outstretched with eyes closed, the homolateral arms bend laterally. So there is a spontaneous deviation which is seen. And if you test the deep tendon reflexes, they will be deep and pendular movements. So these are the cerebellar lesions. How do you test it? Most of you must have done these practicals. Not in our colleges, these topics have been finished till now, but these are the tests which are commonly done in the clinical test. Finger to nose test, rebound phenomena, dystrocogkinesis, heel-knee test, and toe person. I'm not going into details of these particular tests, but this is how you are testing in the clinical laboratory. You will be having these tests as a clinical examination pattern. I think that is all regarding this particular exam point of view, the view of cerebellum, circuits, and the functions. Thank you all. Hello.
Thank you so much, ma'am. It was a very wonderful and a detailed explanation of your session. And I hope all the students and the viewers would have got benefited through your session, ma'am. Ma'am, let's wait for a few minutes for the queries from the viewers.
Okay, fine. Thank
So,
you.
in meanwhile, we'll, ma'am, can you please stop sharing the presentation?
Yes. I can see the chat box.
Yes, ma'am. Yes, ma'am. I can. So thank you for such a beautiful presentation, ma'am. I hope all the viewers you have enjoyed the session. And
Thank you very
please
much,
share.
Doctor.
Thank you so much, ma'am. It's our pleasure. And viewers, share our YouTube channel and our Facebook page through this link given. And you can also access the recorded video, MCQs, and all the announcement of the sessions will be made at the Facebook page. So we have some important and interesting session after this at 6:30 to 7:30 by Dr. Deepa Babin from SR Medical College, Trivandrum on the topic meningitis. And this is the schedule for tomorrow. So tomorrow we have 5 to 6 myocardial infarction from Dr. Asitu Debroy. And session 2 is by Dr. Vinod Doraisamy on the topic A to Z of ECG. Uh, as we don't have any queries or suggestions from the viewers, I think we can wind up the session. And thank you so much for
Thank you.
spending your beautiful time for us.
Thank you very much, Kavya.
Thank you so
Thank
much.
you, your team also. Okay. Should I leave the meeting?
Yeah, no, mom, we'll just stop it over here.
Okay, fine.
Okay, viewers, thank you all. Hope you have enjoyed this. Like, share, and subscribe to our YouTube channel. And thank you all, and see you all in the next session today. Thank you, viewers.